Hi, everyone. My name is Hannah Went. I'm the Director of Operations here at TruDiagnostic. We are back with another Q&A session and have a really fantastic guest for you all today. We have Dr. Kristin Dawson, and she is a double board certified psychiatrist and director of mental health at Wild Health and leads their ketamine clinic in Lexington, Kentucky. She is trained in multiple psychotherapeutic modalities, including MDMA-assisted psychotherapy. So thank you so much, Dr. Dawson, for joining. We're excited to have you.
Thank you for having me.
Yeah, would love to just jump right in and get started. Can you just give us a little bit more background about yourself and tell us about your company as well?
Yeah. So as you mentioned, I'm a psychiatrist. I've worked with kids and teenagers and adults, so across the lifespan. And I'm currently focused on the intersection of mental health and kind of overall health, but taking a more of a holistic treatment approach to caring for folks with psychiatric conditions. I'm pretty interested in mindfulness and meditation, and in the last couple of years have gotten pretty interested in some of the newer treatment modalities for folks with mental health, which many of your listeners may or may not be familiar with, but the kind of psychedelic assisted therapy space is an area that I'm pretty interested in.
Absolutely.
And so I work for Wild Health. Oh, go ahead.
No, just was saying, I think that's becoming very, very popular in this space as well, right? It's getting a huge voice in the media recently too.
It really has. I was just getting my hair cut recently, and my hairstylist is asking about what we're going to talk about today. She saw the Netflix special on how to change your mind. And so it really does seem like a time where the community is really excited about having some newer treatment options for folks with mental health. And what I really appreciate about working in the Wild Health ecosystem, so Wild Health is a precision medicine company. And so we are really big on biometrics. We're really big on genomics. We're really interested in personalizing treatment for whatever health condition or disease prevention that a patient is interested in. So we take a ton of data on people and come up with a very specific and lengthy health report that is delivered in conjunction with a precision medicine physician and health coach, so that people really have direction in terms of if they're going to make some lifestyle changes, getting very granular and specific about how to go about that based on that person's unique makeup in the areas of nutrition and exercise and sleep and stress management. And really all of those things are so key to good mental health as well. So I love the ability to be able to work within this precision medicine space.
Yeah, definitely. You're taking more of that holistic approach, looking at every area of that person's health, and then with all of that being, I guess, data driven to make decisions on what they may need to improve, change, or shift in terms of their habits. So I really love that. I've said it before on a lot of, podcasts and things I've done in the past. I'm a huge believer in really digging in and addressing those lifestyle factors before moving on to even some type of supplementation, medication, or even a procedural based therapy. Because, if you don't have those things figured out that are mostly, in your control, then it's almost like putting a bandage on everything else and not really getting to that root cause. So I'm very excited to be working with you all in Wild Health. More, I would say, specifically the reason we wanted to talk today is the trial you all are doing with ketamine. So I know ketamine is becoming a very, very popular intervention in this functional space that you were just mentioning. Can you explain a little bit about how Wild Health has been using it and then what they've been seeing it, what types of benefits, or, just give us the full realm of that intervention?
Yeah. So as you mentioned, ketamine is becoming more widely available. So I'll just start off with kind of the mental health disclaimer, which is that It is not an FDA approved use of ketamine to treat for depression and some of the mental health conditions. That being said, there is a really exploding body of research to support the use of ketamine interventions for primarily treatment-resistant depression. That's where all of our kind of mental health studies started. So treatment-resistant depression, the definition changes based on who you talk to, but in general, we think of treatment-resistant depression as somebody who has had a depressive episode and they've sought out treatment. They've perhaps tried one or two, in many cases, multiple kind of first-line medications, thinking about the SSRIs, the SNRIs, with psychotherapy, and they have not gotten better.
Sure.
So they have not, they've been seeking treatment, and it just hasn't resulted in an improvement in their symptoms. And so that population of patient was first, in a clinical trial, administered IV ketamine in a single dose. And what was so, there are two things that were really exciting about that first study. One of which is, this treatment-resistant population was getting better. So people that have been tried on so many different things, they are finally getting relief, and it was rapid. One of the really unique properties about ketamine for mental health is it works quickly.
Wow.
And we just don't have a lot of options that aren't things that take weeks and months to work for people. And again, if you're a person and you've been suffering for months and months from depression, my goodness, how welcome is it to have something that's going to work in as little as 4 hours after the infusion? So that was really kind of groundbreaking, or kind of, it was just so exciting in the field to see that. Since that initial study, things have been fine-tuned, and we continue to have more studies to try and help us understand what patients are going to benefit most from this, how to dose it, how to couple it with therapy. Because one of the things that we've found is that although people can feel better really quickly, it doesn't necessarily last, forever. Symptoms can come back. And so that's where we started seeing the use of 6 ketamine infusions in what's called an induction series for patients.
Okay.
And what's really important, and what Wild Health very much emphasizes, is coupling it with psychotherapy.
Yeah.
So there are a number of really cool things that ketamine does in the brain. But one of the things that is important to highlight is that there's this therapeutic window that happens after a series of ketamine infusions, where if you pair that with psychotherapy, with a trusted therapist, somebody that the patient feels comfortable with, feels like is a great match for them, you can get benefits that last longer. And so I would really highlight that for potential patients or just people interested in ketamine. The way that Wild Health, I think one of our unique perspectives, I think, is again pairing this rapid treatment for depression, whether it's kind of major depression or it's bipolar depression. Now we're also working with folks with chronic trauma symptoms, severe anxiety symptoms. What we do is we really encourage folks who are benefiting from the ketamine treatment to then think about entering into our Wild Health program, because they're uniquely situated to have this relief of the symptoms that they've been experiencing for so long, and enhanced motivation and enhanced energy, and really kind of, like I talked about, this psychotherapeutic window where if you introduce these lifestyle modifications and you teach people how to eat for their genetics and how to exercise to enhance their overall health, you get not only the mental health benefits from the ketamine treatment, but now you're doing something really important to help them maintain the reduction in their mental health symptoms and improve their overall health span and lifespan. So that's the part that I'm most excited about, I think.
Absolutely. It's, you're getting that treatment for maybe, one other reason, but it's going to open up every single door in terms of your health and your life and improving that. So that's very interesting. And you touched on my next question I was going to ask there, which is if you do the, I know a lot of clinics that do the ketamine, they'll also offer those therapists while undergoing that treatment. So it's nice to know that you have that option as well, while they are undergoing that ketamine treatment. And I heard you say, psychotherapy. For our listeners, can you just differentiate, when people talk about therapy in general, they usually just say, well, I'm going to therapy for XYZ. What is the main difference then between the, I guess, generalized therapy and then when you say psychotherapy? Can you just elaborate on that a little bit?
Yeah. So, yes, therapy can be just this umbrella term, and we don't necessarily help patients understand how to navigate the different types of therapy and therapists that are out there.
Mhm.
Um, so in the psychedelic, I'll just kind of say within sort of the psychedelic movement in terms of using it therapeutically for people, there's this maybe newer concept, or I guess old concept that's become new again, called integration sessions. And an integration session it's a type of therapy, but it's kind of specific to what happened during the psychedelic or the medication session. A lot of times you can have in those sessions, you can have images that come up, you can have memories, you can have visuals, you can have emotional responses.
Sure.
There's a lot of variation from person to person about what happens in the actual infusion itself. Some people would say that those dissociative effects that happen with ketamine are like a side effect.
Okay. Yeah.
I would actually say that they can be incredibly therapeutic experiences that can be used in psychotherapy. So one type of psychotherapy would be an integration session where the therapist talks with the patient about what they experienced, and then starts to help them understand how they can take those experiences and apply it to their life, maybe revisit old memories, maybe look at, some people come out of an infusion experience and they just have this deep calling or prompting to do something that they haven't done in a really long time. And so the therapist their job might be to say, okay, let's get, specific about how you're going to implement, for instance, wanting to be more creative and explore music, for instance. Let's come up with a plan for you. Yeah, let's come up with an action plan and then kind of help them implement that.
Awesome.
So that's one kind of route you can go. A different route would be to use our tried and true evidence-based psychotherapies that are specific for particular diagnoses. So the one that most people maybe have heard about is CBT, cognitive behavior therapy. So that may be a type of therapy that, again, it's typically 10 or 12 sessions. It's very much exploring the relationship between your cognitions, your behaviors, and your emotions. So it's helpful for depression. It's helpful for anxiety. You might, after perhaps a ketamine infusion series, pair with a CBT therapist, a cognitive behavior therapist, to address the depression that you were doing the infusion for. That actually has been studied in terms of reducing the relapse to another depressive episode when paired with ketamine. So it does have some evidence. That's a good one to try. But I would say, it's really been the only one that's been, studied since we're so early on this. Right. So there's a lot of different types of therapy that could be explored. One that we use, and I think is a great pairing with our trauma patients, is cognitive processing therapy. Okay. And that's a type of therapy that the reason why I think it pairs well with our trauma patients is one of the things that the ketamine can help people do is really be more flexible in their thinking. Yeah. And in that particular therapy, we're looking at what are called stuck points. So thoughts that seem to prevent a trauma patient from healing from the experience and kind of moving forward with their life. And so because of the synaptogenesis and the neuroplasticity that ketamine affords, their brain is kind of primed to re-look at these thoughts that they've been telling themselves and kind of repeating to themselves that lead to these negative emotional responses related to their trauma. So that's a long answer. I guess I could go on.
I love it. I love it. So yeah, and adding on to your last point too, it's almost there like in this feedback loop, right? Of these thoughts coming up over and over again and trying to get through those and process them correctly. I am learning so much on this little session here. So no, I really appreciate that answer, because I think a lot of times when people talk about their therapy, it's this big taboo, right? So I think even, differentiating those types of therapies is very important. Get a little bit more defined in the issue that people are trying to address, because, I didn't know that there are all these different types of specific therapies out there even. I guess I assumed they were out there, but in terms of the differences, I definitely wasn't clear on that. So I appreciate that answer. And I think our listeners will find that really insightful too. Yeah, and kind of switching gears a little bit, we're going to move on
Yeah.
to more of the methylation and the ketamine connection here. So we know you're doing that Wild Health is doing the ketamine trial, looking at these epigenetic methylation markers. And, historically, we've seen that methylation is able to detect events such as PTSD and other, cognitive events that may have happened in someone's past. Even past trauma can accelerate biological aging. We've known that in a ton of epidemiological based papers. And this study that you're doing is one of the few that will not only be able to just look at biological age through methylation, but investigating gene expression as well. So are you hopeful then to find some type of mechanism for the effects of ketamine, looking at which genes are changing pre-intervention and then post-intervention?
So,
I know that's a heavy
good
worded
question. Let me break it down.
Yeah.
There's a lot there. It's so much there. Well, so I'll say this is a small pilot study, and
Yes.
really kind of we're exploring the connection between, well, let me start off with the epigenetics piece of it. So what we know about mental illness is that people who have mental illness, and in general, the more severe, the bigger trauma history, folks tend to accumulate more chronic medical conditions.
Sure.
When they have serious and persistent mental illnesses. And what we also know is that they don't tend to live quite as long.
Yep.
And so often the field of mental health, I mean, appropriately so, we're trying to treat the mental health condition, but we're not necessarily addressing or haven't gotten very far in understanding, well, why is having depression an independent risk factor for development of cardiovascular disease and dementia and diabetes, and why is it that even if you control for if they're a smoker or not, or if they're exercising or not, even if you control for all these factors, they still tend to not live as long.
Right.
That's a pretty big deal. And for Wild Health, with us being so interested in promoting health span and lifespan, it seems like a pretty important thing to try and tease out and try and understand better.
Yeah.
Right. And so you're right. There have been studies that have looked at depression, PTSD, bipolar illness, that have seemed to link the epigenetic changes and methylation in particular to an accelerated biological aging process. Mm-hmm. And so we wanted to take a look at that and see whether or not rapidly treating the mental health condition, hopefully reversing the depression and reversing the PTSD, if that could slow down the accelerated aging process from a biological level for our patients. Could we detect prior to the treatment that they potentially were having this sort of accelerated aging process happen for them? Can we give them the course of this rapidly acting intervention, which is also anti-inflammatory, by the way? So there's a number of different things ketamine is, good for. At the end of that, are we able to kind of slow down that accelerated aging process or not? And so that's the big question that, that we're trying to answer with our primary outcome.
Yeah.
At the same time, we're also interested again in this idea of personalizing medicine. And so genetic SNP chip, which has, I think, like 650,000 single nucleotide polymorphisms that it's checking on our participants. So we would love to be able to identify genetic variants that potentially could predict, response or not to ketamine, again, response or not to any slowing of the epigenetic aging process.
Sure.
We're looking at things like dissociation in the ketamine experience, how quickly they respond. So we're interested in again, understanding these biomarkers and how can we maybe predict or alter the treatment to not only treat the mental illness, but also again, promote overall health for our patients.
Definitely.
Does that answer the question?
Yes. I'm gonna tie that back together here because lots of thoughts going through my brain as well. It's great that you're basically using it's not almost this multi-omic approach where you're looking at these different biomarkers to be able to see what exactly is changing. So in the case of methylation, something we're absolutely going to do with your study is we really specialize on the interpretation of those methylation markers. So we'll do a really nice DMR. Graphical representation, and those DMRs, those are going to be those differentiated methylated regions. So again, look at the same person before and after, and then as a cohesive group before and after, which methylation markers increased in their methylation. So if you're increasing methylation, that means that gene's being shut off, and then if it decreased in methylation, that gene is being if it decreased in methylation, that's shut off. So you're not getting, it's being turned on. So you are getting the expression there if you have lower methylation. So with that and looking before and after, we'll be able to see which genes those are associated with and even look at maybe the mechanism of action to which that ketamine may have been working on. And then you have the genetic factors as well. So you'll even be able to compare both of those, which I think is really interesting. And I think maybe even the only interventional trial that is currently doing that with us. And, we have about 30 of them going on right now. So the more data, the better, right? And it's just going to lead us to I'm sure we'll get some answers from that, but then it's like when you get the answer to one thing, you have 1,000 other questions that lead to another. Like you mentioned, this is more of that pilot trial. So it'll be really nice to test in even others as well. So rounding out just some.
Yeah, I mean, I would.
Oh, go ahead.
Sorry. No, we just froze for a second. Go ahead.
Yeah, no, we was just gonna round out as well. Can you give us a little bit more detail about the study? Which patients are actually recruited, right? Do they, how do they fit that inclusion and exclusion criteria? And are you taking any other biomarkers just besides those epigenetics and genetic markers too?
Yeah. So we've actually recruited all of it's a small study, so just 20 participants. So everybody is enrolled, and I think we're finishing up with our last one or two folks in their infusion series.
Gotcha.
We have focused on the 18 to 64-year-old range, which is pretty common for ketamine interventions. There are just maybe a couple of folks who are looking at ketamine for the adolescent population. Sure. We're not gonna go there quite yet. That's a big lift to treat patients. And then also we're sort of cutting it off and not necessarily treating our older patients. So would love to include those populations later, but for right now it's kind of this 18 to 64. We have included folks with depression or PTSD. Honestly, most of our folks have both diagnoses. Gotcha. So we're seeing a pretty severe patient population. And part of that is we are excluding folks with more mild range symptoms. So we're using some validated rating scales for both depression and trauma symptoms to include folks who have more moderate to severe range symptoms. Sure. The depression folks have to be treatment resistant. So again, this isn't something that we're not using ketamine in folks who have never been on, a course of an antidepressant or psychotherapy. So they're in that kind of category of harder to treat depression. Yeah. We have had to exclude folks who have co-occurring addiction with this smaller study. Let's see what other exclusion. We can't take pregnant folks.
Right. Typical exclusion criteria.
And then, anyone with a pretty severe medical condition. And that's really to that's just to safely administer the ketamine. And then folks who have had psychotic symptoms in the past, there is some concern that's more kind of theoretical concern that ketamine could worsen psychosis or precipitate psychosis in folks who've had those symptoms in the past. So we've had to, for this study, exclude that. Yeah. And then other biomarkers. So I mentioned we're doing the wild health genetic chip on folks.
Yep.
We're also doing a very large panel of labs. So, things like thyroid and cortisol and vitamin levels and lipid profiles, we're measuring those things. And then I think important because of some of the other epigenetic studies have looked at kind of this loading of trauma history. So we're using, it's not a biomarker, but it's a questionnaire about, it's called the Adverse Childhood Experiences Questionnaire. And so looking at before the age of 18, traumatic experiences that an individual may have been exposed to. What we know about what's called the ACEs study is that a number of adult health outcomes are related to the number of different ACE exposures that people have. And so I can tell you for this study, we seem to be, we have enrolled folks who are on the higher end of that ACE questionnaire scale.
Perfect.
I think that's all the things we measure. I feel like there's a lot of spitting saliva and there's a lot of lab taking involved.
A lot of poking and pricking. Yeah. And yeah. We're reiterating that as well, Dr. Dawson, for our listeners, the ACEs, that is going to be the adverse childhood experiences. So again, potentially traumatic events that may have happened as a child, correct? Am I defining that correctly?
Yeah.
Perfect.
Yeah. And it's an open source questionnaire. People who are interested can take it on their own, but yeah.
Perfect. Yeah, no, super. All of this is so interesting. I'm really excited to get the results and look through the data and see what we can find out. This is my final and last question here. I know you all are looking at so many other biomarkers and it's so exciting, the more data, the better. But what's next, right? What are you excited about in the future? Are there any other types of neurological interventions that you're going to look at? Just what's next for you personally and even, of course, Wild Health?
Wow. So there's a lot of things I'm excited. I mean, but I guess, so one of the things I think I started to mention was we're really trying to come up with a report for potential ketamine patients, looking at their polygenic risk scores for how rapidly they might be a responder to ketamine and how likely they are to have a dissociative experience during the infusion, as well as how they metabolize the ketamine to, again, really personalize and help people understand what to expect and really match the treatment to the person.
Sure.
So I'm really excited about that. That's underway right now. I think personally, as somebody who still loves to do therapy with patients, I am really hopeful and excited about the potential to offer MDMA assisted psychotherapy to patients. And then after that, psilocybin. So, if and when that becomes legal, we are situated and prepared to move and offer that. Because one thing I've learned in doing clinical research involving ketamine is, again, how much of a need there is and how long people have been waiting to have something offered to them that's going to offer relief relatively quickly.
Right.
By and large, the people in the MDMA trials sponsored by MAPS, they've on average, I mean, it's like, suffering from their symptoms for 10 plus years before finding relief with the MDMA trials. So I'm hopeful about that. And then again, this pairing of treating mental health symptoms and then piggybacking that with precision medicine, so that we're not just treating the mental health symptoms, but we're also doing something pretty profound to hopefully increase a person's lifespan and, you know, with symptom free from their trauma symptoms or their depression symptoms. That's what I hope for our patients. That's what we continue to work towards.
No, I think that's amazing. And I also think it's reassuring that you all are prepared, right? You see the trend, you see this happening maybe in other places. So it's comforting almost to know that that's going to hopefully be available very, very soon. And who knows, maybe we'll have to do the psilocybin and an MDMA, you know, therapeutic based epigenetic methylation trial or a small clinical trial again to see really what's happening there, and then look at other biomarkers and genetic factors on top of that. The whole goal being to bring this back to that personalized medicine to increase health span, increase lifespan based on more of a custom plan rather than get more of this, you know, sick care model. So I'm super excited about everything you all are doing. But that's all I have for you. So thank you so much, Dr. Dawson, for being on here. And thank you all for listening to our Q&A session here at TruDiagnostic.